We can get started.
Okay.
So welcome back, everybody. We have Dr. Courtney Wolfe-Christensen now, who's going to be speaking about mental health. And this is her bio, just to give you a brief introduction. Dr. Wolfe-Christensen is a clinical psychologist at Cook Children's Urology program, where she's responsible for coordinating the urologic care and providing emotional support for patients with spina bifida and their families, as well as offering psychological support and therapy for parents of children with genitourinary conditions, including differences in sex development. Whew, that's a mouthful.
Right.
She believes an essential part of her work is to help parents understand their child's diagnosis and become comfortable with it, which I think is so commendable. Dr. Wolfe-Christensen currently serves on the board of directors for the Spina Bifida Association of North Texas. She received her bachelor's degree in biopsychology and cognitive science from the University of Michigan and received her master's and Ph.D. degrees in clinical psychology from Oklahoma State University. She completed an internship in pediatric psychology and a fellowship in neuroimaging at the Children's Hospital of Michigan. An avid sports fan, she loves all Detroit teams and the University of Michigan Wolverines, which I can't get behind, but
okay. It's okay, we'll forgive you.
Just a reminder, everybody, if you have questions as Dr. Wolfe-Christensen talks, please use the Q&A format, or you can also submit them to the chat. We'll try and get to everybody while we can. We'll save some time at the end to answer some last minute questions. And with that, I'm going to give it into your capable hands.
Thank you. All right. Hi, everyone. Thanks to those people who are watching and who end up watching the recorded session. Thank you to Julia for inviting me to speak. I hope this is helpful. I will say that this is honestly one of the hardest talks I've ever had to put together because it can cover so much stuff that I could probably talk to you all day. So I tried to really condense things down. So please, if you have questions, pop them in that box, send them through the chat, and I'm happy to stop throughout my talk to answer them for you. And it can be questions, especially as we get to the end, if it's a kind of a specific question, maybe to you or your family, but that other people could benefit from hearing, feel free to ask that as well. So we'll talk about an example later about what to say when your child tells you they know they're supposed to cat, they just don't want to. It's pretty typical. So anyways, my talk is updated mental health guidelines for people with spina bifida and their families. Hey, sorry, oh, there we go. Okay, so what is mental health? So when we talk about mental health, we talk about emotional, psychological, and social well-being. It impacts how we think, how we feel, and how we behave. And there is kind of a pattern between what we think, how we feel, and how we behave. And so when we talk about therapy, we talk about changing those thoughts, like what we're thinking. For example, if you were, you went up to a group of, and I usually use this for my kids, but you went up to a group of kids at school and they were all laughing and you came up to them and they stopped laughing, what would you think? Most people would say, I would think they were talking about me. And how would that make you feel? You'd probably be sad and down, maybe embarrassed. And then how would you behave? And you might just kind of shut down for the rest of the day because that first automatic thought was something negative about yourself, right? So if we use that same situation and flip it, and so same thing, you go up to a group of kids, they were laughing, they stopped laughing, and your immediate thought is, oh, Michael must have just told them the story about what happened last night at the football game. That was hilarious. And if that's your thought, then you're going to feel happy and at part of the group, right? And how are you going to behave? You're probably going to have a pretty good day because you started your day out laughing, not thinking poorly about yourself. So when we think about that, it's a triangle. It really focuses on what you're thinking. And we're going to talk about that a little bit later because it comes into play. It's really important when we're talking about depression and anxiety. So our mental health also influences how we deal with stress, how we interact with others, and how we make choices. So this is the front page to the guidelines for the care of people with spina bifida. If you are not familiar with this resource, I highly recommend you all look at it. There's also a mobile app that you can download from the website too. And the website's down there at the bottom, but it's Spina Bifida Association. You can just Google SBA guidelines. And this is the index page for the 4th edition that came out, I believe it was 2018. And as you can see underneath that second section, psychosocial context for self-management, there are family functioning, mental health, self-management, independence, and quality of life. And so each one of those is something that is found to be important by experts in the field of treating people with spina bifida. And you can see, I mean, it's a pretty decent sized section. I am really excited and honored to say that I am chairing the Family Functioning Committee of the new revised guidelines that will be coming out. And I'm part of the mental health group as well. And so the information that I'm going to give you today is what is going to show up in the newest mental health guidelines. So you kind of get a sneak peek. It's not dramatically different from what it has been in the past, but we definitely have learned stuff, especially in terms of protective factors and how we can help people cope better. So people with spina bifida have medical conditions that go along with it, right? Might have hydrocephalus, impaired sensation, neurogenic bladder, seizure disorders. But then there's also the psychosocial pieces that go along to it. So there's anxiety, depression, sexual relationships, treatment compliance. And these are all intertwined with each other. And so it's really important that when we treat a patient with spina bifida and their family, that we really think about both the medical and the psychosocial piece. And I will say one thing about working, I work full-time in pediatric urology at Cook with 4 surgeons. And one of the things that they'll tell you is they can do what they would consider, quote unquote, a perfect surgery, right? But if the family doesn't understand what the postoperative care plan is, if the kiddo is not consistently self-capping when they're supposed to, you know, all of the, they're not doing ACE flushes, all of these things are important. And so the surgery itself can be done really well, but most of them will tell you that the most important part of it is the psychosocial piece. Who's helping to take care of the kiddo and stuff after surgery. Oh, and if y'all are any of my patients, you might see your pictures pop up, of course, with your permission. So we talk about kind of 3 different groups of people. So we have parents of people with spina bifida. We have kind of childhood patients with spina bifida, I guess 4 technically, and then adolescents, young adult, and then adults with spina bifida. And I'm, again, going to briefly touch on each of these groups, but feel free to send in those questions because, again, I could give a talk, an hour-long talk on each one of these. So parents of a child with spina bifida are at increased risk for having higher levels of anxiety, high levels of depression, and more parental stress. They also perceive their child to be more vulnerable. And so how does that affect their parenting? Is that they can be more overprotective. So if you are worried about your child getting sick or worried about how they're going to do on the playground, you tend to help them a little bit more, right? And so that dependence, while it's really important when they're little, as the child grows, those parents have to learn how to kind of step back. And that's often a point of conflict. So when we talk about family conflict is typically more around when the kiddo is 12, 13, 14, and is starting to have to be responsible for their care, but they're a teenager. The other thing is that especially moms after birth are at increased risk for postpartum depression. And so this is something that we work with at our facility. We start prenatally and meet the families and really try to put some services into place for them because we know that they're going to have a rough road ahead of them. So what can these parents do? So if you look at the data, and this is all from research studies, so improvement in partnerships, so whether that means a marriage, a significant other, even kind of co-parenting, whether it's a parent and a grandparent, whatever it is, the relationship between the adults who are taking care of the child is super important. And we'll talk a little bit about how we could potentially do that. Also, increase social support, and especially spina bifida specific support groups. So just like we're doing here, right? Doing an education day, y'all meeting each other, getting to talk to other moms, because I tell families all the time, I can tell you what the literature says, and I can tell you what my experience has been being in this world for the last 15 years. But the reality is I don't know what it's like to have a baby with spina bifida. And so in our clinic, we have a family advisory council. And so those parents help to make sure that we are addressing the needs of parents of new babies with spina bifida. And then our parents also serve as parent mentors. So, they are much better at explaining feelings and understanding all of that. And it wouldn't be fair for me to think that I know what that's like. Some other ways that you can improve coping. So increase communication with medical providers. And this is one of those areas where we talk about uncertainties. So not really understanding your child's diagnosis, not really knowing what the prognosis looks like, what treatment is going to include, all of that. So the more you understand of that, the less uncertainty you will have. And so my job, and my patients laugh when I tell them my favorite thing is to tell one of the surgeons that they did something that made the kiddo or the parent mad. So give them that feedback, like, hey, you said this, or leaving the room, and then there's the surgeon will leave the room, and I'll say to the parent, okay, what do you understand about the surgery that you're going to get ready to consent to? And they're not sure. So then it's going back to the surgeon and having him or her come back into the room and start again. And so I really like to be in the room with our surgeons when we talk about surgery planning. And I always say I'm asking questions of the surgeons that the parents don't know they should be asking, right? Because none of us know what we don't know. So individual and couples therapy, and you're going to see the therapy pop up quite a bit actually. But that's always an option. And then also medication. It's okay if you need some help to manage your anxiety. It's okay if you need to get on meds for depression. Just especially if this is the first time in your life that you've ever tried medication for anxiety or depression, the chances of you having to stay on it lifelong is not extremely high. And I don't want to give you numbers because I don't know those data off the top of my head. But it's okay to do a trial for a few months to really get you through that, first few months in the surgery and the NICU stay and all of the stress that comes along with it. So why do we care so much about parents? Well, I'm a parent and I love parents, but we know that parental adjustment is the best predictor of child adjustment. So we know if we can get our parents coping well with the diagnosis, understanding it, they are the ones that are going to have the children who are most likely to also be coping well. And sorry, I'm just going to check this chat box real quick. Actually, Bree, would you mind if a question pops up in there, would you mind just letting me know?
Yeah, absolutely. We have
perfect.
One so far. Do you want me to sort of just interject, or do you want to wait until the end? It's up to you.
No, you can go ahead and interject whenever people have questions. That's fine.
Okay. Yeah, absolutely. So the first question was, I find my biggest mental health beast is PTSD. Do you know if that's common or if it's just me? That comes from Elizabeth.
Yes. So Elizabeth, it is absolutely common, unfortunately. And it's one of those things that we haven't studied extremely well. We know that PTSD due to medical trauma is a real thing. I have quite a few kids in my clinic who are dealing with it right now. And I don't know kind of if you're a parent, if you're affected, I'm not sure where you are kind of on that spectrum. But we know that patients with spina bifida are they have surgeries, they have things done to their bodies that they didn't necessarily consent to, right? And sometimes those surgeries have to be done for medical reasons. We have to protect kidneys. Our surgeons don't like to operate if they don't have to, but then that causes that trauma. And so we're going to talk a little bit about actually kind of the next section when we talk about what we can do to help kids cope. And that will be kind of the same thing that we can think about more long-term for our adults and parents. But Elizabeth, feel free to ask a question again later if I haven't answered that for you, but you are not alone. Just know you are not alone. So one of the things that I say most often in my clinic is anxiety is contagious. So if you are somebody who is not anxious by nature and you are in a room with somebody who is anxious, you're going to end up feeling anxious, right? So when we have a parent who's anxious, their child is going to feed off of that. The child is going to be more anxious. And so sometimes I tell parents, look, You have to fake it until you make it. When you go in that room with your kiddo in the pre-op area, you have to figure out, what breathing can you do? How can you calm yourself down so that you can project to your child and model for your child that everything is going to be okay. And yes, your child has a right to be scared. They have a right to be nervous. All of that is true. But then we talk about what are those things that we have in place so that we can make sure that we're addressing the concerns of the child. Plans are really important. Sorry, hang on, I lost. Okay, there we go. When we think about our kids' behavior, as a parent, remember that children's emotional distress often comes out as physical behaviors. So these can be tantrums, they can be meltdowns, they can be stomach aches and headaches, and they wake up in the morning and their stomach hurts and they don't want to go to school. It's very possible that there's something going on at school that they're avoiding. Whether or not they even realize it is something else. But we know that our mental health can directly affect our physical health. And the other thing to keep in mind, especially when we start talking about depression, is that children's sadness, and especially teenagers, sadness can manifest as irritability. So I would argue that when we're looking at a diagnosis of depression for a teenager, rather than sad and down and depressed, I would say irritable. And so again, sometimes parents say, well, my child's not sad, they're just super moody and all of those things. And so sadness manifests itself in different ways. And anger is a secondary emotion. It's easier to be angry than it is to have to admit why you're angry, right? Because typically that sadness comes from feeling alone, feeling left out, whatever those kind of negative feelings are. And so, sorry, continue. So children, what are children at risk for? And I don't want this to come across as kind of a doom and gloom presentation either. I just wanted to make y'all aware of what you can look out for, and then we'll talk about how to address it. Because Elizabeth, I don't want people to feel alone, right? Your question about PTSD, it's very relevant. So children are at risk for having symptoms of depression, anxiety. PTSD would fall under that. Neuropsychological deficits. So these are what we consider higher order or executive functioning. And these are tasks such as planning and shifting your attention, and a lot of tasks that are consistent with what we see in kids with ADHD. And so those neuropsych effects can affect everything at school, can affect social situations. Sometimes our kids aren't able to control their impulses. So they're really kind of in your face and have a lot of energy. We also know that kiddos are at risk for having lower health-related quality of life, having social difficulties, and again, whether that is difficulties in terms of being able to interact with people, or whether it is being a full-time wheelchair user and having a playground potentially that's not completely accessible. We do know that kids with spina bifida are less likely than their healthy peers to see friends and have social interactions outside of school. And then they have less autonomy. So they're more connected to their parents, they're more dependent on their parents. And again, that makes sense, right? So when we think about earlier, parents have to be more overprotective than you would for a typical child, because you have to be watching out for signs of shunt malfunction, and you have to be capping your kiddo, and you have to be looking for UTI, and you have to be checking for sores, right? So all of those things, but remember that there's a level to it which you have to start kind of backing down, as difficult as it is. So coping strategies for kids, and this first one is what I was thinking of when I was talking about PTSD, but it's perceived control, right? So it's giving the child as much control of the situation as possible. And this can be something as simple as, which arm do you want us to check first for blood draws, right? You can't let a kiddo, or an adult for that matter, choose which arm you draw blood from, right? You have to look at veins and figure out where is the best spot, where's the best chance of hitting it on the first poke. So you can't necessarily say, I want you to draw from my right arm, but you can say, hey, I think my right arm's got a good vein. Can you look at that one first, right? The other thing that we talk about in our clinic is the difference between medically necessary surgery and what we call quality of life surgery. So medically necessary, again, kidneys might have hydronephrosis. They might not be functioning at 100%. We're really worried. And so our surgeon has to go in and do something, whether that's a vesicostomy or an augmentation or whatever it is. However, on the flip side, as long as our kiddos are healthy from a medical standpoint, we can talk about surgeries to help them gain continence so that they're not having urinary accidents and they're not having fecal accidents. But those surgeries, again, are more for quality of life as opposed to medical. And so in our clinic, those surgeries don't move forward until the patient agrees to them. And while there's a point at which anxiety plays a role and we do all of that, but that's kind of where that's my favorite part of my job, honestly, is really getting kids ready for these procedures. And then saying to the surgeon, okay, they're ready. They understand what's going to happen. They know they're going to have pain. They know what their belly is going to look like when they wake up. I always say that I've done my job if when your child wakes up, they don't freak out by what they see in their belly, right? Because it's not pretty, especially in the beginning. But most of our kids, the vast majority of our kids will tell you that it was worth it down the line when they're wearing underwear to school, something they never thought was possible. When we talk about those neuropsych deficits, this is where it's really important, parents, for you to get 504 for your kiddo. A 504 plan is a plan if your child only needs physical accommodations. So might need to go to the nurse's office to catheterize, might need to use the elevator to go up to a different floor, those types of things. Once you start talking about neuropsych needs, so difficulties with comprehension and potentially learning disabilities and those kinds of things, you need to elevate that 504 to what's called an IEP, an individual education plan. And that is something that within the IEP, you can address the physical accommodations as well as the academic accommodations, because those are really important. I always tell parents, push for an IEP. 504 plans are less work for the school, right? And so if your kiddo is getting all the accommodations necessary and you can keep it under a 504, that's great. But if you can't, if you need extra help, that's where that IEP comes in. And then also getting our kiddos involved in adaptive sports and adaptive activities has been shown to really help with mental health. In addition, it puts them into contact with other kids like themselves. Support groups, especially Spina Bifida specific. I know we have a phenomenal camp here in North Texas called Camp TLC. It takes typically 100 kids, around 100 kids with Spina Bifida for a week away at a fully accessible camp. And our kids absolutely love it and they thrive. And I can't tell you how many times kids are text messaging their group chats while in my office, and the group chats are from their friends at camp. And again, just as we have parent mentors, we also have patient mentors, and especially in our clinic, we have some patients and we do try to match kids up just so that they can talk to somebody else who's been through what they've been through. We have quite a few kids who might be the only kids who are wheelchair users in their school, or a kiddo who is 13 and has never met another person with Spina Bifida, right? Individual therapy, if you're starting to have concerns about mental health, anxiety, depression, any of those kinds of things, individual therapy never hurts. It's not medication. It's not, a surgical intervention. It's really giving your kiddo an outlet. And most of them are not going to love it at first, but if you feel like it's important, your child better than anybody, I highly recommend it. And we'll talk at the end about some resources that you could potentially use. And then encourage independence, as hard as it is, right? So when our kiddos are little, if they're cathing, encourage them to help you get all the supplies ready. Talk them through what are the steps. First, we wash our hands, we put our gloves on, we open the catheter, all of those things, and then let them help along the way. And that very gradual transition of responsibility is the best way to really encourage independence in your kids. And it's not just with cathing, it's with everything else. I'll tell you, I have a 14-year-old son, he does not have spina bifida, but this just reminded me that we've gotten to a point where I just get a great alert on my phone and I say, hey, I got a great alert today. And at that point, I am not dealing with it anymore. And so it is his responsibility to log in and figure out what class that's for. And if I get more than one grade alert in a 24-hour period, that's when I go in and actually check things. And so again, really, I'm not perfect by any means, believe me, as a parent. But that's one of those things that I have found to be helpful at this point. And then adolescents and young adults are risk for anxiety and depression. And as you can see, that anxiety and depression piece flows through all of these groups of people. Intimacy concerns. This was something that I actually learned from a panel of adults a couple of years ago at a conference. And one of the gentlemen said he was married to an able-bodied woman. He worked in finance. He was very well respected. And he said that nobody had ever talked to him about whether or not he could have children. And so he started dating the woman that he ultimately married, but he said they had been together for a year before he even knew if he could father a child. And so when we talk about, when I asked him, what are things that you wish you would have been told, in your pediatric clinic or in your transition program? And he definitely talked about intimacy and that that's something that we need to know. And so it's something that I kind of sprinkle throughout my treatment with our family. So one of the things I do talk to the parents about when the babies are born is that, we would expect that their child would be able to be a biological parent, whether they need some help from artificial reproductive technology. Sorry, I totally blinked on that. Or not, we'll have to wait and see. But there are also plenty of able-bodied people who also rely on that ART. But also intimacy concerns that you could potentially impregnate somebody. I can't tell you how many times I've seen big eyes in my clinic. I had one kid tell me, oh, I thought because I was in a wheelchair that I couldn't get somebody pregnant. So again, those are important conversations to have. They have increased dependence on parents. We've talked about that. And then family conflict. And this is where kind of that adolescence, and those of you who are raising a child with spina bifida or any chronic illness, you have extra stuff to deal with around adolescence. I had our nurse practitioner say to me recently, so-and-so is here today. Courtney, I don't know what's going on with him. He's always been perfect. He caths every 4 hours, takes his medicine. She said he came in for urodynamics. He hasn't taken his oxybutynin in 8 weeks. He's not cathing. His mom is having to cath him because he's waiting so long. I don't know what's going on with him. And I looked at her and I said, Lauren, he's a 13-year-old boy. Like, that's it, right? Could there be other things going on? Absolutely. But the reality is that adolescence is a time where nobody wants to have to do these things, right? Take medications, catheterize, do whatever it is, go to PT and OT. And so this is just kind of a spot where you could definitely find conflict. Bree, I just saw you pop back on.
Yeah, I'm just saying that there's a couple of stories that people are posting, not really questions, but just, their experiences with mental health. Elizabeth was expanding a little bit on the PTSD and how she had gone through a significant physical journey in terms of just trying to get physically better, that it felt like her mind is playing catch up because she was just in physical survival mode for so long that she didn't have time to deal with what was really happening. But it's a topic, sharing on mental health and spina bifida is a topic she feels very passionate about. And so she just wanted to share that story. And then
Thank you.
Christy was also speaking as an adult with spina bifida about just when professionals use patronizing words, tones of voice or verbiage, that they don't listen to the person with spina bifida because they're attributing the symptoms to something other than what the patient is telling them about. And it usually turns out that it's truly a physical or medical issue that needed to be addressed. That they weren't listening to the person who actually knew what they were feeling and what's going on. And if I didn't catch everything, Elizabeth and Christy, that you had posted, feel free to correct me. But thank you for sharing your stories.
Yes, absolutely. And that is exactly what you said, y'all. It's so important, right? That you're in survival mode from a physical standpoint. And that's what your neurosurgeon, surgeons, we laugh about this in our clinic, surgeons don't really like feelings, right? They like to go in and fix things and then move on. They don't like too much. Yeah, they have to be able to separate kind of their emotional functioning from what they do at work. And it's really important to be a good surgeon. But then the kind of downside of that is then you need somebody else who's going to come in and do the opposite, because you would never want me operating on you. I promise it would not be pretty. But it is true. And then listening to our patients and families, and I remind our docs all the time, and remind myself, because again, I am not perfect. And if I say anything in this webinar that y'all find to be patronizing or offensive in any way, please, please, please let me know. You can put it in the chat. You can email me after, because I certainly don't want to be contributing to that. But I know I'm sure there are things that come out of my mouth that I don't even realize are affecting people the way they are. And then sometimes I say something and think like, oh gosh, that was really not the right thing to say, but it already came out. So let's keep going. Let's figure out what we're going to do with it. But yes, as a parent, if you are really concerned there's something wrong with your kiddo, you keep pushing until you get an answer. And as someone who is affected, it's the same thing. Like, that something in your body has changed. And you probably are tired of people telling you it's in your head, right? And so it's okay to pursue that and to advocate for yourself. It's really important to advocate for yourself, because I'm sorry.
Sorry, go ahead. You can finish your thought. We have another question.
Oh, no, go ahead. Go ahead.
Kristen asked, how and where do I find a counselor? I've tried to get into our Spina Bifida clinic, but no one will respond back, and I'm looking for counseling.
Yes. So at the end of the presentation, I'm going to give you kind of some places you can look for resources. Well, first of all, if you're trying to get into the Cook Children's Spina Bifida clinic and no one has called you back, that is a huge problem that I'm concerned about. I am technically on medical leave right now, but if y'all reach out, I will get you in. Like, we will make it work, and it would break my heart to know that somebody is trying to get in and can't. Having said that, there is a website called psychologytoday.com. And it's one of my most favorite resources to use, especially in Texas. We have families that travel hours to see us. And I certainly don't know therapists in all of the different areas. So that's kind of one place to go. As an adult, again, and when you look at Psychology Today, you can put in what insurance you have, you can put in kind of medical conditions or whatever it is to try to find somebody who matches up best with you. And I always tell people, if you're going to try a new therapist, go at least 3 times. If after the 3rd time you don't like them, it's okay. And you can even ask them for another referral. Like, I've had people that have come to see me and said, like, yeah, we're not vibing. Like, I need to see somebody else. And I can say, well, you should see my colleague, Emily. She and I are very different. We work really well together, but we're just very different in the way we approach things. So if you don't like how I'm approaching it, I feel fairly confident you're going to like how she approaches it. And the opposite happens too, right? I have kids who say, you're the first person I've been able to talk to about this, or you're the first person that knows anything about spina bifida, and so I don't have to explain my medical condition to you. We can just talk about, where I am and where to go from here. So definitely, and honestly, if you're having trouble, I said for our North Texas clinic, but if you're having trouble getting into a clinic, you can always reach out to me too, and I can help you try to navigate that process, even if it's not ours, because I think that's super important. Okay, so coping strategies for adolescents. So that same kind of adaptive sports and activities, and I know y'all just heard a lot about that. That transfer of responsibility. So in our clinic, we talk about, we don't use age as the point at which kids start being responsible for their medication and their cathing and all of that. It's really based on development. So it is very unique to each child, adolescent, adult, in terms of when they are developmentally ready to take on this responsibility. And it starts with, teaching your child. I just had I'm an 18-year-old patient, and no one has ever taught him how to refill a prescription. And when he calls, he gets really, really anxious, and he stutters when he gets anxious. So he can't call the pharmacy. So we had to download the CVS app and log into his profile. And now all he does is he clicks the button refill, and the refill gets sent to his house, right? So helping our kids to learn those steps is really important. So when you start doing things like calling to make appointments, calling to refill prescriptions, put your phone on speaker and just let your, child, adolescent, young adult, hear the words that you're using and how you're asking for what you need, because that modeling, again, is super important. So adults with spina bifida are at risk for declines in health-related quality of life. And we think a lot of this is related to transition to adult healthcare. Any of you who have made that transition know the adult world and the pediatric world could not be any more different. And I should have put it on here. There's a hilarious TikTok about, maybe if I can find it, I can have them send it to you, but a guy who, it must be his first time in an adult clinic, right? And he's saying, what do you mean you don't have animals painted on the walls? And what do you mean I'm not getting a sticker or a sucker for having my blood drawn? And what do you mean I'm not, and so that transition is really important. And hopefully those of you who are affiliated with the Spina Bifida program, in pediatrics, that there is a plan in place to help you transition to adult providers. A lot of adult providers, and I'm speaking kind of from, I can speak from the urology standpoint and the ortho standpoint, but in terms of a lot of times the adult providers are overwhelmed by our patients with spina bifida and are concerned that they're too complex and that they don't fully understand the diagnosis and understand the surgeries that have happened, and so they're reluctant, right, to take them on as patients. So I will say that currently in our clinic, we're still seeing quite a few of our adults for both urology and orthopedics, because we're having a hard time with insurance and finding providers in the adult world who feel competent and comfortable treating them. And we certainly don't want them being lost to follow-up. And so we just have our older kids, and then our teenagers and our young adults. We know that adults with spina bifida are at increased risk for having lower rates of unemployment as compared to healthy peers. More financial dependence on parents. Obviously, those two things kind of go hand in hand, right? And then depression. And I'm not sure why I didn't put anxiety on here, because anxiety definitely is on here as well. And so let's talk about what kind of coping strategies. So again, that transition to adult healthcare is super important in terms of your physical health, right? Vocational training. So, if you're somebody who has maybe some neurocognitive difficulties that, are making it hard for you to figure out kind of a career path, maybe look at some vocational training programs, see what else there is out there that you can do and be successful at. Continuing to do those adaptive sports and activities, continue to participating in support groups, intimate relationships, talking to your partners about, your condition. And I'm not going to go into too much detail. I'm not sure kind of the age range of the people who are watching right now, but, there are different positions that can be utilized in terms of protecting hips and balance and trunk control and all of those. And so that's something that can be discussed. Individual therapy, again, is always a great thing to talk to somebody. And then that should be financial independence. So, being able to go out and make your own money and have a job and be less dependent on your parent or caregiver. Okay, so sorry, those are my dogs if you can hear them. So we're going to move and kind of look specifically at anxiety and depression, just because these pop up everywhere. Anxiety and depression have quite a few symptoms that overlap. So things like agitation, irritability, fatigue, problems concentrating, sleep problems, pain, muscle tension, all of those things could be symptoms of either anxiety and or depression. And then when we look kind of further out, how do they differ? So, right, so depression is having depressed mood, a loss of interest or pleasure. So this is called anhedonia, and this is one of those things that you lose interest in something that you used to really enjoy doing. So, you know, you were somebody who really loved crocheting and you're not crocheting anymore. Or you're somebody who really loved going and playing tennis and you're not doing that anymore. Problems with appetite. Some of us eat our feelings. Some of us can't eat when we're having depressed feelings. Feelings of worthlessness, suicidal ideation, low self-esteem. The flip side of that is anxiety. So anxiety is more of a physiological symptom as opposed to more of a psychological symptom, if that makes sense. So anxiety is having dry mouth, maybe having some heart palpitations, stuttering, trembling, just being really worried. But just something to kind of keep in mind. So, depression involves hopelessness. And this is kind of in regards to treatment compliance and following up with recommendations. But compliance can be affected if a patient doesn't have optimism that their behavior will make a difference. It doesn't matter. Like I'm not going to get any better, so why do you care if I cath? It's often associated with social isolation and withdrawal from family and friends, whose emotional support and assistance could be really helpful. So again, oftentimes this happens during that period of adolescence, right? They're in their rooms with the door closed, you're not cool anymore, they don't want to spend time with you. But the reality is we need to make sure that the way that our teenagers are coping is in a positive, healthy coping way and not shutting everybody out, you know, only wanting to eat dinner in their rooms. Please, if there's one thing I can tell you, don't let your teenager eat dinner alone in their rooms. Make them come down and eat with somebody else, whether it's the whole family, whether it's one person. Don't let them do that alone. Depression can also be associated with deficits in cognitive functioning. So literally you can be so depressed that your brain, those neurochemicals in your brain, neurotransmitters, are not at the levels at which they need to be. And it can affect your ability to remember things like medications and other treatment recommendations. One of the things about depression and its relationship to other things is it's typically linear. So over on the left, you can see depression and productivity. So if you're working, oh, sorry, there's a typo too. As your depression increases or gets worse, your productivity decreases and gets worse, right? So if someone is incredibly depressed and goes into work, they're not going to be very productive. The other flip side is that depression is highly correlated with other distress. And another typo, sorry, y'all, including anxiety and uncertainty. And so on this graph, as you can see, the more depressed you are, the more other types of distress you can have. Okay. And so anxiety is different, right? So there's an overlap with those symptoms that we talked about, but anxiety does not have a linear relationship to outcomes like depression does. In fact, there's what we call an optimal level of anxiety. So if you look at this graph, so arousal level is anxiety and performance quality is how well you do something, right? So if you have no anxiety, you're bored, you're apathetic, you really just don't care, you don't have any motivation to do your work, right? So you need to have some level of anxiety, right? I don't want to let somebody down. I have a deadline I have to meet. You know, there's people counting on me. I have a grade, all of those things. And so that level of arousal or anxiety is what is going to end up giving you the best performance quality, right? So you're motivated to do well and you do well. If we keep going down this axis where we have high anxiety, this can be paralyzing. Like anxiety, knowing I have so much to do, I don't even know where to start, right? Those kinds of feelings. And so when we talk about depression and anxiety, they really are different in terms of how they affect us. This is something, one of my favorite things. I'm sorry, this is small, especially for those of you who are on mobile devices, you probably can't see anything, but computers. So thinking traps, and this is something you can Google as well. And so thinking traps typically go along with people who have depression or anxiety. And there are a lot of them. And for example, one of my favorite things is black and white thinking. So it's when we look at situations in terms of extremes. So either things are good or bad, a success or a failure. So black and white, right? And what we need to think is there's always gray in the middle. So for example, if you think anything less than perfect is a failure, you're setting yourself up for this black and white thinking. Or I plan to eat only healthy foods, but I had a piece of chocolate cake, so now my diet is completely ruined, right? If you do any diet plans, they'll tell you, get back on your horse, keep going, right? One bad day is not a reason to throw everything away. Let's see. So should statements. Try not to use the word should when you're talking about yourself. So you don't want to tell yourself how you should, how you must, or how you ought to behave. So I should never feel anxious. I must control my feelings. I should never make mistakes. And you really want to flip those around to wanting to do those things or not wanting to do those things, right? Like, oh, instead of me saying, oh, I know I really should exercise every day, I'm going to say, I'm just not going to. I don't want to. I'm just not going to put forth the effort to make that happen, right? But should statements make you feel poorly about yourself? So coping in general, what do people want? We all want to feel loved and to belong. So feeling secure and that relatedness, having that relationship with other people, that connection, that emotional connection. We want to feel good about who we are. So that self-esteem. To feel that we're good at something, having confidence that you can do something, feeling competent, whether this is related to school or a job or an activity, sport, whatever it is. And then to also feel a sense of independence. So to have autonomy, but also with boundaries and limits, right? So being able to have somebody, being able to call a parent or an adult if you can't figure out how to refill this prescription because you've been doing it this way through the app and now all of a sudden it can't be done. So being able to do that by yourself, but then also having those kind of supports in place. And we all do that, right? It's always helpful to have somebody that we can kind of go to and can help set limits for us. This isn't specifically just for spina bifida. This is kind of for all people. And so some coping strategies. And again, this isn't necessarily specific to spina bifida, but it's for all of our own mental health and functioning. Open the lines of communication. And if any of you come to cook, if you know Dr. Taylor, she tells us this all the time, but her stepdad, when she goes to talk to him, he says, are you coming to me for advice or support? So he wants to prepare himself. Am I just sitting and listening, or am I going to try to offer some sort of problem solving, right? And that's important because sometimes we just want to be able to vent to somebody and we don't want that person to try to fix our problems. Whereas the other side, sometimes we've been, maybe ruminating or really thinking about it in our heads. And now we need somebody to help us problem solve and put things on the table. And so how do you know if someone's listening to you? And that's empathic, active listening. And we'll talk about that in just a second. And then how does it feel to know you've been heard? Right. So communication, and this is something that I'm a pediatric psychologist. That's what I do. So most of my stuff goes back to kids, but this can go for any of us. So find a consistent way to ask your child about their day. And I put this picture of being in the car because I swear I want to say nightmares, but not really, just memories of being in the car and having my mom ask a question and realizing there was no way out at that point, that I was stuck and had to talk. So sometimes in the car, I really, as a mom, I like the before bed. So when you're tucking your kiddo in, asking what good thing happened today, asking if anything bad happened today. and then telling your child something good that happened to you. And you can do this over the dinner table. You can do this, if you work nights and your kids go to bed, you can do it over the phone. The nice thing about this is if you do it consistently, and it doesn't have to be every night, it can be every other night, a couple of times a week, whatever. But if there's something going on in your child's life and they don't know how to start the conversation with you, they know that in the next day or two, you're going to ask, did anything bad happen? And then they can start talking, right? And please remember, parent problems are not child problems. So if you are stressed and going through something as an adult, it's important that you find other adults to lean on, to talk to, and not to burden children with problems that they cannot affect or change, right? So again, it gives your child confidence that you're going to open the door to start these conversations. They can be really difficult for kids to initiate. And your response will determine if your kids tell you things in the future. So this is something, I don't think I have a slide about it, but just because I'm a psychologist and I have to talk about it, but suicide. Your child or your friend or anybody tells you that they're feeling suicidal, the way you respond in that moment will determine whether or not they ever reach out to you again. If you freak out and start yelling and screaming and call 911 and do all of these things, it's not likely they're going to tell you again, right? So if you can somehow stay calm, even though as a parent, hearing your child say that is absolutely heartbreaking, right? Stay calm, asking somebody if they have a plan. So people used to think that if you ask somebody if they have a plan for suicide, that's going to increase the risk that they attempt suicide. And the data actually say that is not true. If there is a plan, if the person has a plan, especially if they're able to have access to it. So for example, if someone said, I would shoot myself in the head, and you say, oh, do you have any firearms in your house? And he or she says, yes, I have 5 handguns in my safe, right? That person is at high risk. Those people need to go to the emergency room. They need to be seen by a medical professional. So improving communication. So what is empathic active listening? It's kind of a 3-step process. It's 1, rephrasing what you've heard, validating what the person is saying, and normalizing those feelings. And so this goes back to Dr. Taylor's dad asking, do you want support or do you want advice, right? So for example, if a child says, they come home from school and you say, did you cath today? And they say, I knew I was supposed to catheterize, but I didn't because I just didn't want to do it, which is understandable, right? So how do you respond to that? I think typically our first response, our first reaction is to jump in and explain why they have to catheterize, why it's important. They know that, right? I mean, our patients understand, our teenagers certainly understand, our adults understand, but the reality is they just don't want to do it. And that's okay and understandable. So we start with rephrasing. So saying something like, it sounds like you're really tired of having to catheterize every 3 hours. And they can look at you and say, yeah, it's terrible. Every time I start doing something, like I have to leave and go catheterize, and I always have to leave the games at recess or leave my friends, or I can't even sit through the whole movie, whatever it is. And then to validate. So I can understand why you'd be frustrated. Having to stop what you're doing every 3 hours must be really annoying. Like that makes sense, right? And then normalize. And I hope this doesn't offend anybody. Teenagers think it's really cool when I say it sucks to have to catheterize. With kids, I usually say it stinks. But it sucks to have to do that, right? And I say I wouldn't want to do it either. Just like I wouldn't want to have to test my blood sugar multiple times a day if I had diabetes. And I wouldn't want to have to take medication twice a day for whatever. I have to do some of those things, but I don't want to, right? And so I get it. It's normal. Nobody would choose to do these kinds of things. And this conversation can really help you get to a place where you can problem solve. For example, if your child says, yeah, it's really annoying because I have to leave math class, or I get to math class 10 minutes late every day because I have to catheterize, go to the nurse, and then I missed the assignment, and then I have to ask for extra help, and it's a pain. But that gives you a perfect spot to start problem solving. Like, oh my gosh, well, let's figure out how can we change times? How can we work around that so that you're not missing the beginning of class? Maybe we need to shift it so you miss the last 10 minutes of the class before, right? And then you're capping, but then you get to math class on time, because missing the end of a class, you know, could be easier than missing the beginning of a class, depending on the class. But once your child, your friend, your parent, whoever it is, feels like you're hearing what they're saying, they're gonna be more likely to problem solve with you, as opposed to, you know, just telling them you need to do this because you have neurogenic bladder and they know that. So sorry, Bree. Hi.
No worries. Just letting people know that we're wrapping this up. We've got about 5 minutes left.
Oh my gosh. Okay, sorry, y'all.
But if you have questions, make sure you're submitting them to the chat, and yep, just giving you a little time update.
Okay, thank you. I'm going to kind of run through these. So actually, the good news is I've done the majority of my talk, but so a couple ideas for kids. One of my favorite things is coping skills bingo. So what you're going to do is identify a list of coping skills for children. I'm going to show you one in just a minute, but you can Pinterest, you can Google. Have your child look through the list and figure out what coping skills they might like to use. So take the dog for a so this one. So take the dog for a walk, maybe watch your favorite movie, go for a jog, talk to a friend, play a video game. And then they can take this bingo card. You can make it as big or as small as you want. And in each box, put in one of those coping skills. And then you can challenge them to, you know, okay, so can you make a straight line? Can you do 4 corners? Can you fill the board? Whatever it is. And then reward them for getting a bingo. And then the nice thing about choosing just a few is that you can update them, right? Like, oh, I'm so tired of this journaling, I want to do something else. So you can always have them coming up with other ideas. And the more they practice, the easier it is for them to identify these coping skills that might help them in the moment. So, right, as they're, maybe they can visualize their bingo board, or what do they have to do to make a bingo? And it just makes it a little bit easier. And sometimes you can remind them, hey, you seem really stressed out right now. Why don't you go check that bingo board, see if there's anything you could do. It's just kind of a fun way to, yeah, to show kids how they can deal with their stress. And then finally, finding resources. So Spina Bifida Association is a great resource. Again, those guidelines are on their website. The app is available through their website. Social media, through Facebook groups. I know our Spina Bifida Association of North Texas has a group for our moms. There are, if you're looking for therapists, there are always county mental health options. You can literally Google the name of your county and mental health, and the information will pop up. There is that Psychology Today website, which I highly, highly recommend as a place to start if you're looking for a therapist. And then a list of families to share contact information. And that's something that we do, again, within our clinic. And then a couple other things. So in-person support groups, whether it's through an agency, whether it's through the hospital. And for our parents, we're working on getting that done, I promise. And then there are places like the NIH, NINDS, and NICHD, who often have research studies and stuff going on, and also great resources in terms of their websites. So questions, and then just showing, this is for all of our non-Texas people, because I'm not a Texan, right? By birth. And so this is something that you do every April. You take your kids out and you put them in a field of these blue bonnets that, I know this is not related, but it's a fun story. So they only bloom for like 4 to 6 weeks, maybe a year. And they're all like regulated. So if there are blue bonnets in a field, you're not allowed to mow the field until they reach a certain point of pollination, or I don't know all the specifics. But anyways, the funniest thing is that these are always like right off the side of the highway. You literally like pull over, like, oh, bluebonnets. You pull over and you make your kids take pictures. And I just reminded my kids today that it's April, and so it's going to be almost time for bluebonnets, and you can tell they were thrilled. So on that note, okay, questions.
We don't currently have any questions in the chat box. Your presentation was so thorough and well articulated that I just really appreciate you being able to explain so well the nature of family dynamics, all of the complexities of having a spina bifida diagnosis, and even just like any person that can be struggling with everyday normal like mental health things. And these are all super great tools to be putting in our toolboxes to be able to use. I even wrote down that coping skills bingo because I work with kids, and I'm just like, that's golden right there. So
it's one of my favorites. So the kids in my clinics have probably heard that, so I apologize, but sorry, my nose is itchy. Well, thank you all so much for coming, and I don't know if y'all are sharing email addresses after, but you're more than welcome to share that. And I hope it was helpful for y'all.
Yes, it absolutely was. Thank you. And if you don't mind sharing your PowerPoint with Robin, I think we're going to be sharing all of the resources with everyone who's in attendance today in a follow-up email. And so we'd love to get those different visuals out to people. So
Awesome.
Thank you.
Yes. And so I will actually, on my PowerPoint, I'll put my email address on the front slide. So if anyone's looking for it, that's where it is. And I will point out, Courtney does not have a U. So annoying. But if you send it to Courtney with a U, I won't get it. But thanks again, y'all. Have a good day. Have a good Saturday.